Let's talk about keeping your eye on the ball when it comes to test selection, whether it's pre-performance test selection or pre-participation physical test selection. We need to know why we're doing it. When I talk to most people, that's usually either performance. We're looking at performance metrics that will give us an idea of what needs to be improved, or we're looking at durability measures, which are designed to reduce the athlete's risk factors, right? And so a lot of times it can be a combination of those things. In this conversation, we were talking about the Y balance test after we talked about a whole bunch of other tests. And he said, I'm only going to use the anterior reach of the Y balance test because it is the only one that's predictive of injury. Well, first of all, from a research perspective, that's actually not true. All three reach directions combined have a great track record of identifying risk, as well as asymmetry in the different directions. Plus, we were talking about performance at that point in time. And as a matter of fact, we were talking about how we identify hip rotation and thoracic rotation limitations. And I said, well, which one are we trying to do? Are we trying to look for durability as far as risk factors? Or are we trying to look at their ability to have that three-dimensional rotation? And that's where the conversation really got interesting. So first off, lesson number one, be sure that you know what the research actually says. And then secondly, know what your goal is, because if you don't know what your goal is, you confuse your goal, it becomes really hard to understand exactly what you should test. If you have questions about test selection or what tests you should be doing in your system, please don't hesitate to reach out. I'd love to answer them.